having corrected the upper now, you want to take out the upper and you want to put in the lower and check for, adjust the lower occlusal rim according to the patient's features. So you want to take off this upper one. Alright. I'm going to place the lower one. Now, just to remind you, the posterior part of the lower occlusal rim was corrected to the 2/3 of the retromolar pad. So the posterior height is adjusted according to his mouth on the inside. The area that really needs to be corrected is the anterior, because we don't know the anterior from the cast. I'm going to go with this in. Once you start adjusting the occlusal plane, you never want to touch the occlusal aspect of the occlusal rim, because if you touch it like this, the soft wax starts to bend. So you always want to hold this side. Okay? Now when you put this in now, when you see this, you see that, relax. You see that, don't worry, I'm not going to hurt you. You see that this corner is close to the front of the mouth, but this corner is quite high. That means my rim is slightly tilted, okay? And maybe I want to correct my height to this lip level. Alright? So I just want to use this as a guide. I'm going to correct my rim to that level, especially the anterior, and then come back with my upper rim. Here. Just going to show it to you. Right. So you can see that this part is more thicker, and I need to reduce it to that. Like before, you want to heat your whole instrument. You want to remember that the posterior is already corrected, just the anterior you want to reduce. So you're going to touch this and wait till the posterior part of the plate touches the back. Once it touches the back, you remove. You don't want to reduce the posterior anymore. So you want to reduce it like this. You see that? Reducing only the posterior till it touches the anterior segment, the posterior segment. That's it. You see how I've reduced it? You see that this area is still not come into contact. So I'm still reducing only here. As this goes down and comes into contact here, I will stop. And you see it's touching everywhere, and I'm just stopping it at this point. You can also see that I've reached my line. So I want to now check in the patient's mouth. Just want to remove a little bit of wax here in the posterior part, using the back of my instrument. Just smoothen off this. Now you see that it is at the level of the lip. Just like here. Okay. You can see that it's at the level of the lip. Again, this side slightly more. I'm going to correct this only in relation to my upper. I'm not going to do anything more. I'm going to put my upper and check for parallelism. Relax. So you see this when the patient is relaxed, you see that the wax is at the position. Sit a little back. Yes. Open your mouth a little bit. Relax. Just slowly. See that? It is at the level of the lip there, this corner. This slightly more can be reduced, but I want to check with my upper before I do any reduction in this.